You're about to make one of the most important decisions for your retirement health care, and I want to make sure you get it right. If you've been hearing about Medicare Plan G and wondering if it's worth the money, or if you're trying to figure out who actually overpays for it, you are in the right place. By the end of this video, you'll have a clear understanding of what Plan G does, why it's become the most popular choice among seniors, and maybe most importantly, how to avoid making a costly mistake that could drain your retirement savings. Let's start with the basics. Medicare Plan G is a type of Medicare supplement insurance, also known as Medigap. It works alongside your original Medicare to help pay for the out-of-pocket costs that Medicare doesn't cover. Think of it as a gap filler. You pay a monthly premium to the insurance company, and in return, they pick up most of the co-insurance, co-payments, and deductibles that come with Part A and Part B. Now, here is why Plan G has become such a big deal. For years, Plan F was considered the gold standard. It covered everything, including the Part B deductible. But back in 2020, Congress passed a law that closed Plan F to new enrollees. So, if you turn 65 after the 1st of January 2020, you simply cannot buy Plan F anymore. This left Plan G as the most comprehensive plan on the market for the vast majority of people. It's essentially Plan F without the Part B deductible coverage. And in 2026, that Part B deductible is $283. That's the single gap you'll have to pay before your Plan G coverage kicks in. So what does Plan G actually cover? A lot. And I mean a lot. Once you've paid that $283 Part B deductible for the year, Plan G typically covers the rest of your Medicare-approved medical costs at 100%. That includes your Part A co-insurance for hospital stays, which can be hundreds of dollars a day. It covers the Part A deductible as well. It covers the 20% co-insurance for Part B services, like doctor visits, outpatient procedures, and durable medical equipment. It covers skilled nursing facility care, co-insurance, and even the first 3 pints of blood you might need. And here is a big one that a lot of people don't know about. Plan G covers Medicare Part B excess charges. Now, I need to explain what an excess charge is, because this is where Plan G really separates itself from cheaper plans like Plan N. When you see a doctor, they have a choice. They can accept Medicare assignment, which means they agree to accept the Medicare-approved amount as their full payment. Or they can be a non-participating provider and charge you up to 15% more than what Medicare approves. That extra 15% is the excess charge, and you are responsible for paying it out of pocket. Here is the kicker. Many people don't realize this is even legal, but in most states it is. With Plan G, you are fully protected. The plan pays that 15% excess charge. With Plan N, you are exposed to it, and those bills can sneak up on you. This is why Plan G is often called the set it and forget it plan. It provides the most predictable budgeting for your healthcare costs in retirement. You know what your monthly premium is. You'll pay the $283 Part B deductible early in the year. And then, you are protected from unexpected medical bills. There is tremendous peace of mind in that, especially if you are living on a fixed income. Now, let's get to the question that's really on your mind. Who overpays? Because you're absolutely right. Not everyone is paying the same price for this plan. And the biggest mistake people make is overpaying for the exact same coverage. Let me say that again because it's so important. Plan G is standardized. The federal government dictates exactly what benefits every Plan G policy must contain. The coverage is identical from company to company. The only thing that varies is the price and the customer service. So, if you're with one insurance company and paying a much higher premium than your neighbor for the exact same coverage, you are overpaying. So, who are the people most likely to overpay? First, people who don't shop around. This is the number one reason. You might think that because you've had a relationship with a certain insurance company for years, they'll give you a good deal on your Medigap policy. That is rarely the case. I can't stress this enough. You must shop around and compare quotes from multiple reputable carriers in your area. Rates vary wildly from state to state and even from zip code to zip code. Companies like United Healthcare, Mutual of Omaha, and AARP offer Plan G, and their prices can be very different for the same person. Second, people who choose a plan with a company that has poor rate stability. A lot of times, an insurance company will offer a super low teaser rate in the first year to get you in the door, but then they raise the premiums aggressively year after year. You need to look at an insurer's history of rate increases. A slightly higher premium with a company that has a track record of stable rates is often a much better deal in the long run than a cheap starter premium that skyrockets later. This is where working with a knowledgeable independent agent can really pay off. They know which companies have good rate stability and which ones don't. Third, people who miss their Medigap open enrollment period and then have to go through medical underwriting. I'll talk about this more in detail in a moment, but this is a massive mistake that can make you pay significantly more. When you're first eligible for Medicare, you have a guaranteed issue right for 6 months. During this period, insurance companies cannot ask you any health questions. They cannot deny you coverage, and they cannot charge you more because of a pre-existing condition. But if you miss this window and apply later, they can look at your health history, and if you have diabetes, heart disease, or some other condition, they can charge you a higher premium or even deny you entirely. That's a classic way to end up overpaying. Now, let's talk about the specific people who might not get the full value from Plan G. If you are someone who's in excellent health, rarely goes to the doctor, and has a lot of disposable income to cover a potential high deductible, a high deductible Plan G might be a better option for you. With a high deductible Plan G, your monthly premium is much lower, but you have to pay a larger deductible, which in 2025 was $2,870, before the plan kicks in to cover everything. You could save money on premiums, but you would take on more risk. For most people, especially those who want predictability, the standard Plan G is a better fit. Another group of people who might not get the best value from Plan G are those who choose it but don't take advantage of the wellness perks that some insurers offer. Companies like United Healthcare and others include wellness extras like a gym membership or fitness program with their Plan G policies. If you are paying for a plan and not using those benefits, you are leaving value on the table. Make sure you understand the extras that come with your policy. But remember, these extras are nice, but the core coverage is the same, so don't let a free gym membership be the deciding factor if the premium is much higher. Now, there is another group of people who might be overpaying for Plan G, and this might surprise you. People who are currently paying for Plan F and are in good health. Because Plan F is no longer available to new enrollees, the pool of people in Plan F is aging and getting sicker. This is what the industry calls a closed block of business. Because no new healthy people are joining, the claims experience for Plan F tends to be worse, which forces insurance companies to raise premiums on that block of business year after year. Many insurance companies are encouraging people to switch from Plan F to Plan G, and it can often save you a significant amount on your monthly premium. If you're on Plan F, it's definitely something to consider. But you must be mindful of the underwriting rules I mentioned earlier. If you switch during your state's birthday rule or open enrollment period, you might be able to avoid underwriting. Here is another reason to pay close attention. One of the most common mistakes people make is paying for Plan G when they could have a Medicare Advantage plan that seems cheaper. I get it, a $0 premium is really appealing. But the difference is that with Medicare Advantage, you are on a network. You have copays for each service, and if you get really sick, your out-of-pocket costs can be substantial. There's no annual cap on your costs with original Medicare and a Medigap plan. But with Plan G, you pay your premium and your deductible, and you're done. Your costs are virtually zero for the rest of the year. With Medicare Advantage, you could be paying copays for every specialist visit, every test, and every surgery. And here is the trap. If you go with a Medicare Advantage plan, you cannot just switch to Plan G later on, especially if you develop a health condition. Under most circumstances, you would have to go through medical underwriting to get a Medigap plan. That means the insurance company can look at your health history and charge you a much higher premium or deny you coverage. So, if you choose Medicare Advantage because it's cheaper today, and then you get sick, you could be trapped in that network for the rest of your life. It's a one-way door for many people. That is why many financial advisors recommend that their clients buy a Medigap plan like Plan G while they have the guaranteed issue right, even if they feel healthy. It's about protecting your future self. So, let me give you the bottom line. Who overpays for Plan G? People who don't shop around and compare rates. People who choose an insurer with a history of aggressive rate hikes. People who miss their guaranteed issue window and get hit with a higher premium due to their health. People who don't consider switching from a closed block like Plan F. And people who don't understand the trade-offs and choose a cheaper alternative up front, only to be locked out of Plan G later when they need it most. The value of Plan G comes from its ability to give you peace of mind and financial protection against catastrophic medical bills. It provides more comprehensive coverage than almost any other plan on the market. And when you know how to shop for it and when to enroll, you can get that protection at a price that works for your budget. Now, I want you to do something for me. If you found this information helpful, please click the like button. It really does help the channel. And if you aren't already, make sure to subscribe and hit the notification bell so you don't miss the next video where we'll dive deeper into other retirement planning topics. I'd also love to hear from you in the comments below. Have you enrolled in a Medigap plan? If so, what was your experience? Are you considering Plan G? Let me know, and I'll do my best to answer your questions. Thanks so much for watching, and I'll see you in the next video.